The Centers for Disease Control and Prevention says subvariants of the Omicron coronavirus strain now account for nearly 99% of new COVID-19 infections in the U.S. Global health officials are tracking at least 2 more subvariants reported in South Africa and some European countries. Experts say a booster dose provides better protection against Omicron and its subvariants than the 2 initial doses of Pfizer's and Moderna's vaccines. Adults 50 and older are now also eligible for a second booster. New research suggests a healthy lifestyle may help delay the onset of Alzheimer's disease. A team of Swiss and American researchers analyzed data collected by the Chicago Health and Aging Project. They found that participants 65 and older who exercised for at least 150 minutes a week and ate a healthy diet not only lived longer on average, they also spent fewer years living with Alzheimer's than their less healthy peers. The study could help medical experts and policymakers plan for healthcare costs and needs. That's your AARP Minute.
Hello, I'm Philippe Largent, the State Director for AARP Illinois. Thank you for joining us today. I want to welcome you to this important discussion about the coronavirus and how to protect yourself. AARP, a nonprofit, nonpartisan organization with membership of 1.7 million Illinoisans, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. As a COVID-wary nation deals with our 3rd year of the pandemic, there is good news as hospitalizations and deaths continue to decline, despite recent uptick in new coronavirus cases. But there is still much work to be done, and many questions to be answered surrounding boosters, testing, and how to protect as we continue to navigate the changing COVID landscape. Today, we're going to hear from Dr. Amaal Tokars, the Interim Director of the Illinois Department of Public Health, and Paula Basta, the Illinois Department on Aging Director, on combating COVID together, the latest on vaccine booster shots, and our post-pandemic future. For those of you joining us on AARP Illinois' Facebook or YouTube channels, we thank you for joining us. Please add your questions in the comments, and we will work to respond to address them during the event. Now it's my pleasure to introduce our guests. Welcome our first honored guest, the Director, Dr. Amaal Tokars from the Illinois Department of Public Health. Welcome, Dr. Tokars. Can you share opening insights for listeners on COVID-19 and why the latest booster shot is so critical?
Okay, thank you so much for asking me that question. I'm grateful for everyone who has gathered and listening. So right now, across the country and Illinois, rates of COVID are going up. And it's really important to know that so that we can know what actions to take. Now, when we're in a time of low, we want everybody to be up to date in their vaccines. Right now, we have a number of areas in Illinois that are at medium risk level, which means we're asking individuals to really think very strongly about taking on their masks in indoor public places if they're elder or immunocompromised or have medical conditions. And by elder, that you could be a very young elder, but that is still going to put us greater at risk. So that's going to be important. And if we enter times of high community levels, then we're all going to want to take on our masks in indoor public places. And so why is that vaccine, that booster, so important? That in combination with the exposure that we all have, unless we're living in a cave, we have all been exposed to this sickness, COVID. And so intentionally choosing to stay up to date and get that booster really in combination with our exposure gives us powerful prevention of serious illness and hospitalization. And that's what we want for you. We want for you to not get seriously ill and not end up in the hospital.
Dr. Tokars, thank you. Next, it's my pleasure to welcome Illinois Department on Aging Director, Paula Basta.
Thank you. Thank you, Philippe. Honored to be part of this terrific panel. So grateful that all of you are joining us and hopefully getting some great information out there. We appreciate AARP Illinois, especially for helping us. During the pandemic, I think many of us know that the Aging Network statewide maintained a very strong focus on protecting the health and safety of our older adults. With the closure that we had to do of all of our senior centers, our congregate dining sites, we wanted to make sure that given the heightened social isolation that older adults were experiencing due to the pandemic, our number one priority was first of all addressing food insecurity. To that end, since March of 2020, our area agencies on aging, our AAAs as I like to call them, have distributed nearly 1 million home delivered meals each month, responding to a 50% increase in demand compared to where we were pre-pandemic levels. So this was a huge lift for our aging network, but we rose to that occasion. In addition to addressing those nutritional needs, the department utilized other state funding that we were able to establish through our care coordination units, our CCUs, called the Emergency Senior Services Gap Filling Fund, ESS. That has assisted estimated over 10,000 older adults since the onset of the pandemic itself. This type of assistance provides a variety, addressing a variety of needs, personal hygiene, providing PPE, making sure that if you had needed home modifications so that you could stay in your home, stay safe and stay healthy, that we were able to do that, making ramps. Assisted technology was a huge thing that we know we needed to get into the hands of our older adults. And so we were able to do that. We also helped with rental, mortgage, utility expenses, making sure again that people were staying safely in their homes. The department also prioritized its service provisions and outreach through an equity lens, very important to our Brown and Black communities throughout the state. As soon as the vaccines became available, the Aging Network kicked into high gear. We began providing direct assistance and support to older adults that were navigating the vaccine registration process with a focus on populations that were reportedly vaccine hesitant. I'm so grateful for our sister agency, the Illinois Department of Public Health, as they were so hands-on with us through their local public health departments to make sure the vaccines were available to those communities. And additionally, the Department of Aging had PPE that were in the hardest hit areas of the pandemic that we made sure that people had access to PPE early on when there was a shortage. So we made sure that we were addressing those kinds of immediate needs. And so to give you a snapshot of what's happening statewide to date, the area agencies on aging, our AAAs, our care coordination units, our CCUs, have engaged over 156,000 older adults in vaccine education, in vaccine outreach, making sure that people had transportation to vaccine clinics, arranging for in-home vaccinations for homebound individuals. Very, very important. And I'm so glad to be here to discuss now moving forward how we can get more older adults up to date with their COVID vaccines, including their second boosters, and making sure that we get some of their questions answered so that those who are eligible continue that path of getting vaccinated and getting boosted. Thank you.
Thank you, Director Basta. I appreciate your comments. Dr. Tokars, let's start this conversation with you. The FDA has authorized and the CDC recommends a 4th dose of the Pfizer or Moderna COVID vaccine for people 50 and older. Who should get the 4th shot and when?
Okay, so we often refer to this 4th shot as the second booster. We find that's a really easy way for people to think about it. And so this is for individuals that are 50 and older, or individuals that are 12 or older that are immunocompromised. So it is primarily for adults who are 50 and older, but there are others that are immunocompromised that may be able to access that as well. And it is 4 months, at least 4 months after your first booster. So all those people are eligible, and that is that added protection, because we know that it doesn't mean that we won't get COVID if we get vaccinated, but most often people are not getting seriously ill if they are being careful and all the way up to date. So that's what that's really important for.
Thank you. Just a quick follow-up, Dr. Tokars. What about those who receive the Johnson & Johnson or J&J vaccine or are immunocompromised and younger than 50? What should they do?
It's really very similar. 4 months after they have received their first booster, though that very same group is eligible for the second booster. So the same ones that you mentioned, 50 and older, and those that are immunocompromised. So really important to get that and to try not to leave gaps there.
Thank you. Director Basta, if you're a senior living at home, please tell listeners where they can go schedule their COVID-19 booster.
Great question. Thank you, Philippe. So you can receive it, and I know many of you have seen the signs as I do at CVS, Walgreens. Your local pharmacies have the boosters. Your local public health departments have them. And of course, we always want you to make sure that you're talking to your primary care physician. So you want to engage just normally who you talk to about your health concerns. Those are the kinds of places and the people you should be talking to. Great website is vaccines.gov. That is absolutely the best, one of the best and quickest ways to find a vaccine provider that is closest to where you live, and then schedule the appointment.
And so that website would be a place where they could get help to online to navigate to get their response. Thank you, Director Basta. Dr. Tokars, U.S. health officials have laid out a national roadmap to manage the COVID-19 coronavirus going forward. It includes free antivirals as immediate treatment following infection, investing in domestic production, stockpiling tests, free home COVID-19 tests, and an expedited approval process for vaccine-specific variants. Are these preemptive changes designed to focus on a new risk or the risk of a new variant?
You know, it is for the risk that we have now and the risk that we could have in the future, because we are getting new variants every few weeks. And so it is really, really important. And you mentioned therapeutics, Philippe, and that's so important. So let me just say a little bit about that. This is for people that are 50 and older, especially. So we know that one of the largest lines of protection is getting vaccinated. We also know that if there's a lot of risk out there, putting your mask up is going to give you some protection, and staying out of indoor crowded places during times of high activity for COVID. But the other piece here is, if you find that you're positive, call your provider immediately to see which therapeutic is right for you. Don't wait to feel sick. When people wait to feel quite sick, it is not nearly as efficacious. Remember, this is not instead of getting vaccinated. This is in addition. If you get sick, your provider will know what therapeutic is right for you. Ask immediately while you're feeling well. As soon as you know that you're positive, call right away. So those therapeutics are important for now, and they will be important in the future as well.
Thank you, Director Tokars. Director Basta, misinformation continues to undermine the public health efforts truly in the pandemic. Can you help debunk some misleading claims and understand why misinformation, and help us understand why misinformation is so problematic, especially when it comes to COVID-19 boosters?
Sure. Thanks, Philippe. Good questions. Again, misinformation, it continues to circulate around COVID-19 and the vaccine. So we're consistently concerned with people not getting vaccinated due to these false claims. It's false claims about safety, efficacy, side effects, ingredients. And so we want to make sure that people know the truth. And the truth about vaccines, that are continuing to protect people from getting seriously ill. Unvaccinated people over the age of 65 are 40 times more likely to be hospitalized, 50 times more likely to die due to COVID than those with a booster. The CDC always recommends now that everyone age 65 and older receive those 2 COVID-19 boosters in addition to the primary COVID-19 vaccination. And so today we want to talk about how important it is. If you have questions about the vaccine, talk to your doctor, talk to your local pharmacist. You can also call the COVID-19 hotline, 1-800-889-3931. Again, 1-800-889-3931, or go to our sister agency website, which is, or email them, dph.sick@illinois.gov. dph.sick@illinois.gov. I also want to make sure that you all have our senior helpline. Again, 1-800-252-8966. 1-800-252-8966. Again, we have a live person who is going to be able to talk to you and help you navigate through this whole process. And of course, again, getting vaccinated, getting boosted is key. We want to help you wherever we can.
Thank you, Director Basta. It's now time to address your questions about COVID-19 and boosters with Dr. Tokars and Director Basta. First, we have Amy joining us from Chicago.
Hi, my name is Amy, and I'm from Chicago, Illinois. When am I best protected with a COVID booster? I'm looking to summer and fall travel plans, and I wonder if I need to schedule my booster vaccination date to align with my future travel plans. When I travel, I really want to be protected, the best, and not to be on the waning end of my booster benefits. Thanks.
Answer that. And the last item that Director Basta answered was just fabulous. I just really appreciate the way she answered that question. So if you are thinking about pacing out your boosters or getting up to date with other important plans you have, let me say this, that's very thoughtful, but the best thing to do is just get it as soon as you're eligible so that you have this consistency of protection and no gaps and surprises. Again, getting vaccinated doesn't mean that you won't get COVID, but what we do know is that most of the people that were in the hospital last month in Illinois were either elder or immunocompromised or had medical conditions or were unvaccinated or undervaccinated, and many a combination thereof. So don't leave gaps. Go ahead and keep yourself protected all the way along, and then be careful about getting in crowded places if you don't know where you are. And there might be times that you do go ahead and put up your mask, especially in public transit.
Thank you, Dr. Tokars. Wonderful question, Amy. Thank you for joining us. Now let's bring on Caroline.
Good morning. My name is Caroline, and I'm from Crest Hill, Illinois. And my question today is, who should get a 4th COVID shot?
So, I mean, obviously, I think we talked about this, anyone over 50, anyone with any sort of immune compromised and chronic illnesses. Again, Dr. Tokars is the best one to talk about all those other nuances. But again, we would like to make sure that those of you who need to get a vaccine and a booster, that you do it. So Dr. Tokars, I'm going to punt that to you again.
Yeah, so you answered that correctly. Here today, our audience with AARP, we're so appreciative of this. 50 and older, get what you need, get what you deserve. And if you have specific questions, you get to your provider and you give them a call. But this is so important, and that is who should get it. All of us. Oh, I'm saying all of us. Look at me. All of us that are 50 and older are wise to have it.
Yep.
Great question, Caroline. Thank you. We'll continue along with Sandy joining us by video. Sandy?
Hi, I'm Sandy and I live near Chatham. My question is, when will we learn to live with COVID and treat it as an endemic?
Honestly, I'm hoping we are doing that right now. And so that would be my opinion. We are from this point on, since this started in March of 2020, we know we are going to live with COVID. And so how we do that, is Dr. Tokars has alluded to, is by consistently having a plan to get immunized, boosted, make sure that you have all the coverage that you need in order to stay healthy and well. Make sure that you're also doing things like exercising, eating well, staying connected to your friends and family who care for you. I think it's all about healthy aging, and that should not change. The Aging Network is there to assist you in all those ways possible. So even though we all want to get boosted, we want to get vaccinated, we also know we want to live well, right? We want to make sure that we're engaged in how we stay connected to other folks, because it's all about how we are going to live now going forward within this new landscape that we must absolutely try to understand best how to be healthy. Again, senior centers are starting to open up, congregate dining sites are starting to open up. So connect with your local area agency on aging, find out what's happening, but please stay engaged.
Dr. Tokars, the same question to you. When are we going to start living with COVID and treating it as an endemic?
Yeah, so technically, endemic is about the stability of the disease. Is it not going up? And so it is going up, but the real point is we are living with it, and we are going to be. And so this is really an important time to live in wisdom and joy. And just, we know what to do. We know what to do, and what to do is not very hard. So there isn't any reason that we can't be living our lives in the fullest. So we don't want to have fear, because there are so many other things out there. We drive our cars. There are people on the road that shouldn't be on the road. We do all kinds of things that we need to do in our lives. There's no reason for us to live with a hovering burden or fear. And I think Director Basta, my good colleague, made really important points. Take beautiful care of yourself, your physical health, your mental health. Enjoy your loved ones. This is the most important time of life. So we don't need to be burdened by this disease. We just need to resist it. And elders have done the best resistance of anybody in the country. They have done what they need to do and will continue to. And that is why we're with you today.
Thank you, Dr. Tokars. And let's keep the conversation going. Next, we have Al from Chicago.
Hello, my name is Al. I'm from Winfield. My question is, my home test kit has expired. Can I still use it?
We're advised not to use expired things. So here in the United States, we like to not use expired things. Before you get rid of it, you can check at fda.gov, because a lot of those have been, those expirations have been extended. But if it's not been extended, we just always advise not to use expired things, but it may be extended. So again, fda.gov will lay that out.
Great question, Al. Thank you. Let's take a question from Jim.
Hi, this is Jim from Chicago, and my question is, who is currently eligible for the latest booster?
This is our 50 and older group, but it's also individuals that are 12 or older that are compromised. But the 50 and older group, please get that booster. That's it for this latest one, the one that we call the second dose. That is for 50 and older. So thank you for asking that question, and get that booster for yourself.
Thank you for the response. And Jim, I think that's a question that's on everyone's mind. Now we've got Verna on the line from Romeoville.
Yes, hello, I'm Verna. I am from Romeoville. My question is, Who is responsible for making sure nursing home residents in Illinois get the latest booster? Is it the responsibility of the resident, a family member, or the facility to make sure this is done?
Wonderful question. We know that all long-term care facilities have access to the COVID-19 vaccines. So even through their local public health departments, they have access. The specialized long-term care pharmacies in some of those nursing homes also have the vaccine. So we know they have the vaccines in the facilities themselves. They're providing the vaccines for the residents. They're also can be doing vaccines for the loved ones. So I think it's just a matter of talking to the facility owners or the people in the staff, the administrators, to find out how is the vaccination plan rolling out? How is the booster plan rolling out? And I think that hopefully they will give you that answer. If there's an issue or a concern or a problem, again, I would go and give this back to the Illinois Department of Public Health, and so they can go and investigate it. But Dr. Tokars, again, if you have more to add, please go ahead.
Many of the nursing homes in Illinois are working with pharmacies to bring that in. They don't have to. They find that a more practical way to do that. I think it's really important as a family member that you ask the facility administrator, what is the plan? Is it this summer? What is the plan? And if you want to do something different, you certainly can. But I would ask, and many of them are partnering with these pharmacies to bring that in to make it a little bit easier. But that is so important, and it's always important that families are asking and paying attention. So thank you so much.
Great question, Verna. Now let's talk to John from Chicago.
I'm John from Evanston, and my question is, can I pick up a free COVID-19 home test for my local pharmacy now with Medicare?
I can tell you that, yes, you probably can. People with Medicare can get up to 8 tests within a calendar year per calendar month from participating pharmacies, from healthcare providers throughout the duration of COVID-19, especially because we are still in a public health emergency or a PHE. So that has been extended. And so we are able to get these kinds of tests very easily and very easily accessible because of that. I also want to make sure that you know that you can just check with your pharmacy, make sure that they can have a test readily available for you, but you can always check Medicare website, the medicare.gov website, or I can give you a 1-800 number to give them a call. There's somebody there who can answer that question given where you live. Maybe they have an idea of where the closest would be. And that's 1-800-633-4227, 1-800-633-4227, and that's medicare.gov.
We appreciate you talking with us today, John. Thank you. Joining us from Central Illinois is Connie.
My name's Connie. I'm from Peoria, and I would like to know how the Illinois Department of Aging will help seniors get access to the vaccine.
Thank you. We have been, since the rolling out of the vaccine process of which began February, March of 2021, we have been hands-on around doing clinics, around making sure people can get access and partnering with both local public health departments, pharmacies, primary care physicians, all the different public health, Cook County public health departments, that you are able to get those kinds of vaccines. And then homebound, like for example, are very important too, that we are partnering with local public health departments around homebound, getting folks homebound vaccines. The city of Chicago has the Chicago Public Health Department that they themselves have a program that they're partnering with. I believe it's EMTs, fire department, so that some of our first responders have been actively on helping with homebound vaccinations. So it's a matter of, again, what I would say is probably calling up the senior helpline, telling us where you live, and then giving you that local resource. Again, the senior helpline is 1-800-252 1-800-252-8966. 1-800-252-8966. Great question. Thank you.
Thank you. And our last caller joining us today will be David.
Hi, my name is David, and I'm from Chicago, and I'd like to better understand what are the effects of 2 COVID vaccinations and 2 boosters on the body? Thank you.
Answer that. So, as many of you know, when you go to get a vaccination, in particular one of these vaccinations, the purpose of it is to really wake up your immune system. And so, you know, when you get that vaccination, you may be feeling, and I'm not even talking about the sore arm, because that's not really, that's just kind of the thing that we always have, but you could get a headache, you could get a low-grade fever, you could feel very, very tired. This is your body really ramping up its immune system. So when you are up to date and you've had your first and second vaccine and your first and second booster, you have really done a lot to keep your immune system awake and ready and prepared. So that is the really important effect that has on the body. Now, I do want to say, because sometimes when people ask it, they're all thinking about, what about those stories that I've heard about these significant adverse reactions? All medicine has some percentage of adverse reactions, and it has been very uncommon for these vaccines to have very serious adverse reactions, but there are some. But let me just tell you what has happened most often is that long COVID is becoming more and more common. And this is an adverse reaction that some people have been living with since the beginning of the pandemic. And so that is something that we really want you to pay attention to. Again, if you have a particular concern about your health circumstance, that's why it's really important to go ahead and make that call to your doctor. Your doctor knows your health history, but the ramping up of the immune system is by design what should be happening to protect you for now and the future.
David, thank you so much for joining us today. On behalf of AARP Illinois, I want to say thank you to everyone for taking part in today's virtual conversation on the COVID vaccine and booster education. We've been talking with Illinois Department of Public Health Director Amaal Tokars and the Illinois Department of Aging Director Paula Basta. Thank you both for joining us virtually today. We're near the end of our conversation. Would either of you like to share any closing comments? Dr. Tokars?
I want to thank you, AARP, and I want to thank my good colleague, Director Basta, with aging as well. This is something we all wanted to do together to really advocate, to make sure that people have an opportunity to gain understanding and to know what's happening with COVID, how they can get their vaccine, and how important it is to live their lives fully and enjoy. So I'm just so grateful that you took the time to organize this so that we could speak with our wonderful brothers and sisters from around Illinois. Thanks so much.
Thank you, Director Basta.
Thank you. And thank you, Philippe and Lori, all of AARP Illinois, your team, your staff are terrific, doing a great job making sure that our older adults are out there staying healthy and safe. Dr. Tokars, your people at the Illinois Department of Public Health are doing a terrific job as well, helping, again, our older adults stay healthy and safe. And what I want to say again is thank you to our older adults themselves, who time and time again show us the best ways to live our lives and who are our most and best examples of how we should be doing that in all circumstances. And I want to say that, of course, it's especially important that we're having this conversation in May. The month of May is nationwide Older Americans Month. And so it's a highlight of time of making sure that older adults realize how important they are to this world, to our world, to everyone's relationships throughout, family members, friends. And I want to make sure we know that the theme for 2022 for Older Americans Month was Age My Way. And so I want to make sure that we want to say, focus and stay strong, stay healthy, stay aging in place of where you are. And please, please stay engaged. Let the Department on Aging know how we can help you. And again, I gave you some numbers, phone numbers to give us a call, or make sure you check on our website. We have a website that's full of really helpful information. So again, thank you, AARP Illinois. Thank you, Dr. Tokars. Thanks to all of you.
Thank you, Director Basta, and thank you, Dr. Tokars. This has been a great discussion. Once again, AARP Illinois sincerely thanks both of you, Dr. Tokars and Director Basta, for being with us today and answering these questions. And thank you to our AARP members, volunteers, and listeners for participating in today's discussion. In the face of this crisis, AARP Illinois continues to provide information and resources to help Americans 50 plus and those caring for them protect themselves from the virus, prevent its spread to others while taking care of themselves. For more information about COVID vaccine and boosters, please call 1-800-889-3931 or visit the website dph.illinois.gov. One more time. Please call 1-800-889-3931 or visit the website dph.illinois.gov. You can also obtain valuable information through AARP publications on our website at aarp.org/IL or by calling 1-888-687-2277. Thank you and have a wonderful day. And this concludes our virtual event. Take care, everyone.
Thank you.
Thank you. Bye-bye.